Too many microphones all over the place. I realized I never introduced myself. I'm Irene Malati, one of the neurology docs here. Some of you know me well. And I'd like to introduce our next speaker is Frances Rivera. Frances is a clinical case manager, and she's going to talk to you about what social workers and case managers do. Everybody knows they need a physician. They may know they need some therapists, but you may not be aware of someone else that could be on your team that might help you identify resources in your community that can be very helpful.
Good morning, everyone. Can you hear me? Yes. So thank you for coming today again. It's nice to see familiar faces. For those of you who have not met me before, my name is Frances, and I'm the clinical case manager at the Center for Movement Disorders. You might hear them refer to me as other things, so you might hear them call me human services counselor, social worker, or sometimes they call me superwoman. Just kidding, they don't call me that, but I was making sure you're awake. So today I'm going to be talking about my role at the clinic and some of the resources that I can help you guys with, okay? If I can figure this out. Oh, there we go. So what does a clinical case manager do? Officially, I'm responsible for assessing and attending to the psychosocial needs of patients, which is fancy talk for basically I just ensure that the patient's basic health needs are being met, but also that their emotional, mental, and social well-being is being addressed as well. And not just for them, but also for their care partners. And when I say care partners, I mean anyone who's actively involved in their health care. So that could be your spouses, your family members, friends, or even hired caregivers as well. So I meet with the patients and their families and their loved ones to kind of discuss about their areas of concern, and then we work together to determine how we can address those needs through various resources available. Okay. So these are some of the resources and services that I can help with. It's not a comprehensive list, it's not everything that I help with, but it's the areas that I find that patients most frequently ask about. Is that me doing that, Chuck? Oh, okay. These are the ones that I talk about most often. And so I'm just going to go over each one briefly, but then I'll have time at the end for questions too. And I'll be on the panel later on as well. So one of the areas that I help with is local programs. I help patients with finding local programs that they can participate in. So there's many benefits to them participating in these programs that you see here. One of the benefits is that it helps keep you mentally and physically active, of course, and also it helps you socialize with others that have similar interests. So getting out of the house and just being with other people is always beneficial. These are some of the programs that are offered here in Gainesville. You'll see Sing for Life is a program that's offered with Dr. Smith, who's a professor at the music school, and she meets with patients and uses singing as a tool to help practice breathing, relaxation, posture, which is always beneficial for everyone, but also especially for people with Parkinson's. There's also Dance for Life, which is a group that meets for the patients and their care partners as well, that they can come. And they use dance as a way to practice mobility and balance, and it's also just fun, of course. Art in Motion is another program where a group gets together and they use their time together to do different visual activities. So they'll do like painting or quilting. I remember they said they did something for Dr. Malati once. Therapeutic Horticulture is a newer program that we started, thanks to Amanda, and it's a gardening program done through the horticulture program at UF, which is great, and they learn about different plants, and it's also therapeutic just to be out in the dirt and learning about new things. And also, of course, there's the exercise classes, which are offered at the Senior Recreation Center. They offer lots of different classes at the Senior Rec Center, but specifically, they offer multiple classes throughout the week for people specifically with Parkinson. So it adapts with your condition, and so whatever you can do is always really great. These are just some of the programs that are offered in Gainesville, but for those of you who are not local to Gainesville, they have programs just like this and more, like boxing and golfing, that are offered throughout the state and the country as well. Senior services. So each county has agencies that's responsible for providing home and community-based services to the senior population in that area. These are some of the services that they provide. You can see it's respite, meals on wheels, case management, personal care and homemaking, emergency energy assistance, and much more that you'll see there. Our local agencies here are Elder Care and Elder Options. Elder Care is actually here today. You'll see the booths. If you have time, you should stop by and talk to them about some of the services that they do. Most of the supportive services that I help patients get are through these organizations, so they're a really great program. They offer really great programs, and they're a really great resource as well. Transportation. So transportation is a really big concern for our patients, not only to get to our appointments, obviously, but just to get to the grocery store, to get to the pharmacy, and to anything else that they need on a daily basis. So what do you do if you need to get somewhere, but you can't drive yourself there and you don't have anybody to drive you there? You could take a taxi, you could try Uber if you're tech savvy, or you can try going through one of these programs that are available. The ADA paratransit and transportation disadvantage programs are two of the programs that are offered here, and they're designed to help individuals who have transportation needs due to either age or disability or income. And so our local transportation providers, you'll see, are RTS and MV Transport. So if you're eligible for one of these programs, the ADA or the paratransit transportation disadvantage program, what they do basically is they give you a card that gives you these benefits. So either you can ride the bus for free, so if the issue is income, or they'll do a door-to-door transportation service. So they'll actually pick you up at home and take you wherever it is that you need to go and bring you back as well. And they're fully equipped to adapt to all your needs. So whether you have a walker, an oxygen tank, a wheelchair, or if you have somebody who's with you that you'd like to bring, like a personal care attendant, you can do that as well, and it's all for a fairly small fee. Most of these county transportation programs only do transportation within the county, so I just like to let people know that. So if you're trying to visit your friend in Miami, they probably won't take you down there, but if you want to find out if yours will go to different counties, it's a county by county basis, and I can help you figure that out as well. Prescription assistance programs. So another area I help with is applying for prescription assistance programs. There's various ways that you can go about this depending on your medications, your insurance. So there's lots of different factors that we have to take into consideration, but I help the patients navigate this process. So one option is to apply through a pharmaceutical company, which I know we have quite a few here today. The pharmaceutical companies offer lots of different programs, whether it's copay assistance, savings cards, and sometimes you can even get your prescriptions for free depending on the situation. The Shands Financial Assistance Program is a program offered specifically through Shands and UF Health. It's for low-income and uninsured patients, and if you're on their program, they also have a pharmacy that works with them to provide low-cost medications, sometimes as low as $4, depending on what you need. RX Outreach is an online pharmacy program. It's just one of them. There's lots of different types of online pharmacies like RX Outreach, but they have lower cost medications, and their requirements are much less strict than they are doing it through like a pharmaceutical company. So it's nice to go through them sometimes if your income is maybe not meeting the needs of the pharmaceutical companies and things along those lines. There's no guarantee that the medications that you want are going to be on one of these programs, but as you can see, there's lots of options to explore, so I can help you with that as well. Okay, by a show of hands, who of you either personally have utilized or know somebody who have utilized home health care or respite care? Thank you. Yes, yes. So quite a few of you, so you can see why I probably get a lot of questions about it. So I think the main confusion is that what is the difference between home health care and what is respite care and how do they differ? So I'm going to talk a little bit about some of the more frequently asked questions that I get. So home health care, when we talk about it more often than not, is the services like physical therapy, occupational therapy, speech therapy, skilled nursing, and home health aides as well. That's usually done like in the home because you're usually homebound when you get that. Respite care is more assistance with daily activities, so assisting with bathing, getting dressed, meal preparation, companionship, things along those lines that help give the main primary caregiver a break, hence the name respite. So insurance, more often than not, covers home health care, but it does not usually cover respite care unless you have something like a long-term care insurance or something along those lines. So What are the services provided? I kind of went over a little bit of that. The respite services offer much more than what I listed. I would say they're very comprehensive in what they can and can't do. But you do definitely pay quite a bit of money for it. I would say on average, the cost is probably $20 per hour for an agency like Comfort Keepers, Visiting Angels, and the other ones that I had listed on there. So if that's a little bit pricey for your wallet, which it is for most people, a good alternative is to go through an adult day center, which we have Altrusa House here in Gainesville, which is great. We also have All's Place as well. So adult day centers are a really good cost-effective alternative to going through versus going through something like Grandy Nanny's, because for one flat rate, usually about $60 or so, you'll get a full day's worth of services, including meals and all the activities that they do, and you get peace of mind knowing that your loved one is in a safe place because there's always a nurse there as well. It's really ideal for people who are working and they want to make sure that their loved one is with people instead of staying home alone. Long-term care. So long-term care can be a really tough topic to talk about because we're just not really sure what it is, and also we're just not sure what our loved ones want too. It's kind of hard to talk about that stuff, especially if it's in the future. Sometimes we don't want to deal with it at the time, but it's really important to know about your options so you can plan accordingly. So the good thing is that there's levels, for every level of need, there's a facility available essentially. So starting from the beginning, independent living facilities are for people who can basically still do everything for themselves, but they more so want the benefits of having a community where they can interact with others and have the activities and services be easily accessible in the community. They usually have staff on site, but they provide very minimal supervision. So if you're finding that that's not enough for what you need, you can go a level up, and that's assisted living. These facilities are for people who have a more challenging time taking care of themselves or maybe are not safe at home alone anymore. They have 24-hour staff that provide assistance with meals, medications, getting dressed, all those things along those lines. So it's really great and comprehensive. Memory care is a specialized type of assisted living, so it's for people who have memory disorders like Alzheimer's or dementia, and they have very specific programming that meets the behavioral and cognitive needs of these types of patients. So you can have specific memory care and know that they're catering to their needs. A skilled nursing facility is probably the one that you guys are most familiar with. It is for people who need 24/7 medical supervision, essentially. So if they need constant monitoring or a very high level of need with their assistance with their ADLs, that would be something that you guys go to. And insurance usually covers skilled nursing up to a certain amount, which I'm sure you guys have heard of. You know, if you're in the hospital, you can transition into a skilled nursing facility and you kind of go from there. Continuing care communities. These communities are great because they offer a full spectrum of services all in the same location. So they'll offer everything from independent living going all the way up to skilled nursing facilities. So for people who would like to stay in the same place, but as time goes on, their need increases, they have the benefit of not having to change and move around a lot and still get the care that they need. A good example of that is Oak Hammock. If you've never heard of that one, that's the one here in Gainesville. It's one of the continuing care communities here. So when patients ask about long-term care, I usually help them find facilities that are either close to them or wherever it is that they're planning on going to be for the next few years. And I also discuss costs and how they're going to financially manage the paying for those facilities. Long-term disability and Social Security disabilities. So disability is definitely one of the more complex issues that I come across because there's so many details to it, and each case is unique. You know, some people will say, well, one person got it after 2 months, and it's taken me 3 years. It's just a very complex system to have to go through. So depending on how you're going through it, whether you're applying through your employer, a private company, or the Social Security Administration, I do my best to help you navigate that process by helping you understand what it's going to entail, what kind of information they're going to be looking for, and to help you get whatever it is that you need from us and our providers to make your application complete as well. I can't really go too much into depth with this. Like I said, each case is unique. So if you have a question about disability and you'd like to discuss it further, I'm more than happy to do that as well. Mental health services. Mental health is a topic that I'm especially passionate about because that's what my background is in. When people hear mental health counseling, I think the main reaction is, oh, that's for crazy people. Well, fortunately, it's not. It's for everyone. I think everyone can benefit from therapy. Some of the benefits are that you get to talk to somebody who's unbiased and non-judgmental about the situation. They also teach you how to do different types of coping skills to deal with difficult situations, and it's just good for your overall ongoing mental wellness. Just like you have to exercise to keep your physical health well, then you have to go to therapy and things like that to make sure your mental health is well as well. Since not everyone is familiar with mental health services, when somebody is interested or maybe when a provider feels like a patient might benefit for something like that, I usually help them understand what it entails, what kind of issues they typically help with, whether it's stress, anxiety, or even marital issues. And I help them understand who provides those types of services. So there's a spectrum of people you can go to, whether it's a social worker, mental health counselor, marriage and family therapist, psychologist, or even interns and students, you can go to them as well. So making sure they understand who they're going to and what their qualifications are is something I do. Referrals and costs are something I discuss on a one-on-one basis because depending on whether you're going through insurance or a community program is gonna differ each time. So I do that on a one-on-one basis, so if you'd like to talk about that, I can do that as well. Like I said, mental health is something that I'm super passionate about, so when I started working at the center, one of my goals was to start a free counseling program. And fortunately, with the help of Arlene Dali, who is not here today, but she very graciously volunteers her time to us, I was able to start the CARES program. There you go. And CARE stands for Caregivers Acquiring Resources and Emotional Support. It's a program that we offer at our center directly there where we give caregivers, there we go, caregivers free one-on-one emotional support / counseling. So far, it's going very well. We started at the beginning of the year. Her schedule is packed, which means good things. So I'm really excited about it. I'm glad that she was able to come on board for that. If you'd like to know more information about it, we have flyers where you can take them at our clinic, or you can also just ask me questions about it as well. Support groups. So support groups is a big portion of what I do with Amanda as well, of course. They're very important, I think really beneficial for everyone to participate in because it gives everyone kind of a safe place where they can talk about their concerns and they can learn from each other as well. So if one person has already gone through something, they can kind of suggest their alternatives as to how they found things that were most helpful. We currently hold 2 support groups for our Parkinson's patients. We have our original group, which meets on the 3rd Friday of the month, and then we have our young onset group, which meets on the 2nd Monday of the month. There's no rules for the young onset. Well, you don't have to be a particular age or anything like that. We meet later on in the day so that those who are working can come as well. I know not everyone's from Gainesville, so if you're looking for a support group that's in your area, I can help with that as well. And it doesn't only have to be related to your Parkinson's, it can be related to other things, so it can be like grief or mental health, anything like that. I can help with finding support groups about that as well. I always like to end with the National Parkinson Foundation because they are a fantastic and great resource that provides us with a lot of the things that we have in our clinic. You might see them, all the booklets and everything around. I'll just go through some of the things that we have available, and I'm sure some of you already have it, but if you don't, then you know they're available as well. The Aware and Care Kit, you'll see in the top corner over there, it's the little black bag. That's an initiative that the National Parkinson Foundation started to ensure that patients are receiving the best care possible while they're staying at the hospital. So they were finding that patients weren't getting their medications on time, they were getting medications that they weren't supposed to because it doesn't mix with their medications that they're currently on for their Parkinson's, and these are all very important things to know. So the kit comes with little tools in there like a Parkinson's identification bracelet, a medical alert card, a medication form, and a lot of other things that you can have ready and prepared so that if you ever have to go to the hospital, you know you have everything in there ready to go. They also have those booklets which are down at the bottom, the rainbow booklets, and that covers different topics of interest like medications, speech, fitness, and a bunch of other stuff as well. Yeah, there you go. The great part about these books is that they're very easy to understand. So they're not written so that doctors can understand them and everything. They're just written so that everyday people like me and you can read them and really understand what's going on with your condition. The good thing about these books is that you can either grab them at our clinic or they're available online as well. So if you wanted to give them to maybe a family member or a friend to help them understand what's going on, you can just tell them to look it up or send them a link. They offer it online on their online PD library, and they also have webinars on their online PD library as well, both in English and in Spanish. Also, if you have more questions about the National Parkinson's Foundation or in general about Parkinson's, you can always call their helpline, which is up there as well, the number is. Their helpline is staffed by social workers, nurses, and therapists, and it's offered in English and Spanish as well. So it's a really great resource just to direct people if they have general questions and things like that. Of course, you can always come to us for questions as well, but I think it's a really great resource to have available for everyone. Thanks, Jack. So I know that was a lot of information to go over in a very short amount of time. I wanted to make sure I had time for questions. Just before we start with the questions, if you ever want to meet with me, you can always email me or call me. I always find that people find it nice to just, when you're setting up an appointment, you can just meet with me as well. I'm there at the clinic 24 hours, 7 days a week. Just kidding. I'm only there Monday through Friday. And so just come on by. So questions? Oh, there you go, Chuck. Thanks. None? Oh, that was easy. Good. Hi, Mrs. Mason.
Not a question, but a comment.
Oh, thank you.
This is the first or meeting like this that we've been to, and we're relatively new to Gainesville. I just wanted to publicly recognize Frances and thank her for being there. It has meant everything to us as we transition to this new place. So thank you, Frances, for all the programs and all the support you give us in this community.
Thank you. Oh, that was nice.
No, I don't have. I can hold it.
Good.
I mean, you can sit.
Another thing that's good to know is that there's no charge to talk to Frances. So if you're not sure, maybe you don't even have a need right this moment. Suppose you're just thinking, I'm a planner, I want to think about 10 years from now, what are my options, what's in the community? You know, you can just talk to Frances. There's no charge for that, and she can just kind of give you some ideas.